just, here's a hernia, here's how you fix it, adios. It's a whole set of issues that one has to deal with. Each lesion grows on a series of nerves, and each of those nerves has a function, and often removing those lesions represents nerve dysfunction.
In the 50s, the goal was just to get the patient off the table. In the 60s, the goal was just to get the tumor out and don't worry about the facial nerve. In the 70s, we could get the tumor out and get the facial nerve, but we could never save hearing in anybody. And then in the 80s and 90s, we can get the tumor out, save the facial nerve, and save hearing in select cases. Taking out brain tumors is like working out. You don't want to do it beforehand. You sort of dread it when you're just about to start. Then in the middle of it, you're thinking, wow, this is really great. And after you're done, you feel fantastic.
Sometimes you say, maybe I shouldn't be doing this. Maybe this is just, I'm not as good as I think I am, and then you say, well, I don't know anyone who can do it any better. And if I give up, who's going to do it?
So if you stop to think about it, you have one person's nervous system operating on another person's nervous system. And so what that means is that you take advantage of all the things that the brain can do.
I was a college athlete, and I used to tell people there's this unique experience that you very seldom get in life. And it's when you're so concentrated and so focused on an idea, a concept, a thought, that nothing else you're aware of for that moment. You catch a nice pass in a football game and you're running for the goal line and there's 2 or 3 defenders to get around. There's nothing else you think about at that moment. I haven't experienced that in a long time except during a very intense operation.
I think we're both good at knowing exactly what to do in the operating room. Sounds simple, but it's a sense of judgment. That's probably the thing that's taken both of us the longest to acquire, really. A sense of when to really go for it and when it's time to back off.
It's like coming to a fork in the road. You could go right or left, or you could back up, or you could sit and watch for a while. I mean, there's really 4 choices at a fork in the road, not 2.
We never know what we're going to find when we get inside the head. Every situation is different. I'm fond of saying that the MRI never lies, but sometimes it doesn't quite tell the whole story.
Sometimes we'll both sit down together under the microscope and work together, whether it's his hands or my hands, but it's almost like 2 brains working one set of hands.
And some of these tumors grow to very large sizes, and they can be very difficult to remove. So it's always a situation of 2 heads are better than 1, and 4 hands are better than 2 hands.
He's very open-minded. We bounce things off each other all the time. We almost protect each other from making mistakes.
You know when things are intense with Dr. Roland because he starts clenching his jaw a little bit more. But he's such a cool customer that that's pretty rare.
An NF2 patient is a lifelong commitment to their sense of well-being, to pushing hard, going beyond the boundaries, trying to figure out solutions to very complicated problems. Each patient presents with a very different set of unique problems.
So it can be very frustrating, but I'm not allowed to get frustrated, and certainly when you see the patients not getting frustrated, you really are not allowed to get frustrated.